Hey guys, so today we're going to talk a little bit about the SBAR. So this is a tool that can be used to communicate with physicians, other nurses, or other care team members, and it's effectively a good way to break down the information, especially when you're talking about a critical situation, a change in the patient's condition, or something else. So I'm going to tell you kind of the basics and my experience with this. Feel free to also touch base with your instructor and kind of get their information as well. So to break down, if you've never heard of SBAR, S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. So this is a real basic explaining what they are. So when we talk about a situation, we're saying, what is the situation we're writing about? We want to identify who we are, what hospital we're at, what our title is. We want to briefly state what the problem or issue is, when it happened, how it started, and how severe. So kind of let them know what we're calling about. So we're not just kind of going into and saying, hey, I'm taking care of Mr. Johnson. What do you call it? And, his recent blood pressure is this. And they're like, well, yeah, but why are you calling? Like they want to know first off, okay, why are you calling? You do need to provide them that background. You can't just call a doctor and say, hey, I'm taking care of bed 323. They're going to be like, well, what hospital? Who's the patient? Even if you tell them like Mr. Smith, well, which Mr. Smith? They take care of a lot of patients. Most doctors do. They may be familiar with the patient, but you always want to be, even if they have like a less than normal name, then just never assume anything. Remind them of who the patient is, their history, their most recent stuff that's been happening with them, etc. Then we provide any pertinent assessment data. And this is something you always want to get before you call your doctor. So that's why kind of like on test questions, it'll ask you like, do you call the doctor or do you get more assessment data first? If there's an emergency situation that doing an assessment would prolong or like cause harm to the patient because it's going to delay care, we definitely want to call them first. But most of the time in most of these situations, we need to get more assessment data. Like for example, let's say that I had a patient that heart rate went up to 125. Okay, well, I have that data, but do I also have other things that might be causing it? Like one, do they have a fever? Two, are they in any pain? Three, are they hydrated? Like all the common causes of an increased heart rate. So I'd always have to start with those first. I want to make sure I have as much assessment data to kind of save time for the doctor so that they can make the best judgment of what to do next. So if I call a doctor and they're just like, hey, go back and assess them, or if they ask me a question, I don't know the answer, that's going to be really hard. And again, it's going to prolong them getting the care that they need. So I always want to do a good assessment. We'll talk more about these. And then recommendation, that's talking about what do you recommend or what do you need from the doctor? What's the next thing that you need? So I'm going to switch over to a different document here. Let's see if I can get to it. Aha. So let me get back here. So this is kind of going more in depth. It's saying prior to calling the physician, make sure whoever you're calling, have you assessed the person themselves? Like make sure you've done an assessment. It says nursing manager, but I would say more like, if you have a concern, check with your charge nurse. They might know something more than you do. There's times that even though I get reports, the charge nurse will tell me, hey, yeah, I got in report that that's really common for them, blah, blah, blah. They've already talked to the doctor. So there may be something I don't need to do. They may have some suggestions for me as well. They also may be able to help me to find the physician who I need to contact. You need to know your patient. What do you call it? Like some of their most recent data, labs, vital signs, anything that might be important for them. So as we go through this is kind of a little bit more in depth. And if you Google like SBAR nursing or SBAR sheet, like this is a template I found for free online. So SBAR might look something like this. You might pick up the phone and say, okay, hi, my name is blah, blah, blah. I am calling from this hospital. I'm calling about Mr. Johnson. He's in room 323. He has been having more difficulty breathing lately, and his oxygen saturations have been decreasing. His most recent vital signs were this, and I'm concerned about, I might say I'm concerned about his condition. Then I'm going to go into just as, to remind you, this patient, he's a 67-year-old male. He originally came in with pneumonia. He was getting better and showing signs of improvements after being started on antibiotics, but in the last day he started to get worse. He was having clear sputum, and now his sputum is turning, green or yellow, etc. So I might provide some of those other details. I'm pretty much telling them the story, the background. I would include any assessment findings. Hey, I think they might have a new or a secondary infection. What do you call them? They're stable right now, but definitely seems like we might need to do an intervention. So in this case, like I might say, do you want to get a culture of their sputum and see if something's growing? Do you want to, what do you call them? Is there any other information or labs that you want to get? Maybe they want to get some more recent labs. Maybe they want to get a chest x-ray. Maybe they want to start some breathing treatments or something like that. And you might be sitting here saying, oh my God, how am I supposed to recommend? I'm not the doctor. But with time, you'll start to kind of learn what things may be wanted. And you don't always have to have the answer. Sometimes I literally tell the doctor, hey, I don't know what they need, but something's not right. And that's the doctor's job to kind of figure it out. So, at the end of the day, you just need to provide them with all the information that they need to make that best decision. So that's the basics of an SBAR. Effectively, we just want to set them up with what's the situation, what do you call it? What's the background? What do you call it? Any assessment data that's going to help them to make a decision. And then what are you thinking that the patient might need, or how can you help direct them to make an order for this patient that can help you to give them good care? And so we can use this with physicians, we can use this with other care team members. Some people even use this for report. I'll have a separate video talking about bedside report here shortly. So hope this helped. I'll see you guys next time.